Wayne is in his final weeks of chemotherapy for bowel cancer.
Chemotherapy as we use it today is really drugs given to the highest doses that, from experience and testing, people can tolerate.
To combat the severe side effects of treatment, Wayne takes a range of other medications, but they have limited effect.
After starting the chemotherapy, all my energy had gone. I'd get out of bed and lie on the couch and watch movies and read and really had no energy. And this went on for weeks.
But Wayne's oncologist has prescribed another treatment, fast gaining recognition among cancer specialists. It can fight Wayne's fatigue and nausea, lower his risk of developing secondary diseases, and dramatically cuts the chance of the tumour returning.
I feel now much better than I did on the earlier part of the chemotherapy. I really feel that I'm dealing with it much better.
It can treat the top 10 chronic diseases in Australia. Yet the extraordinary thing is, less than 2% of GPs currently prescribe it. You might be thinking it's some new miracle drug, but it's not. It's exercise. We all know exercise is good for us. It makes us feel better, look better, and function better. It took all my energy to get up at 6 o'clock this morning and go training. And let's face it, most of us only do it when we're feeling healthy or motivated. How many of you exercise when you're sick? I know I don't. Neither did Wayne. Traditionally, cancer patients are recommended total bed rest.
I walked into the lifestyle clinic and I saw some weights there and I thought, oh no, I can't even look at those weights. But they got me on very light exercises, just walking. And I couldn't believe the turnaround. Within a few days I was feeling much better.
The lifestyle clinic is no ordinary gym. Every patron here is a patient being treated for a serious medical condition. Director Chris Saar is part of a global campaign to get doctors to see exercise as medicine.
There is no medicine that can treat a range of chronic conditions like exercise can. We have many medical practitioners that actually are, if you like, exercise therapy naive. They're not familiar with the role of exercise in a particular chronic disease and the mechanisms underlying it and what impact it has as well.
The impact can be huge. Take Margaret. She was diagnosed with high-level diabetes at age 74. Standard medications didn't make a huge improvement to her blood glucose levels.
After 4 years, I didn't get the count down very far.
With nothing to lose, Margaret turned to exercise. She's been pumping iron 3 times a week. Why strength training?
Strength training is an anaerobic activity. It requires muscle contractions, and that's a form of activity that helps to treat diabetes and primarily insulin resistance to try and bring down blood glucose levels.
And it's worked phenomenally well. In just 18 months, exercise has achieved what medication failed to. Margaret's blood glucose levels are now well within the normal range. So Margaret's gone from a high-level diabetic to non-diabetic, essentially, at the age of 80.
Essentially, yeah.
That's incredible.
It is, and it shows what impact exercise can have if you do it routinely and progressively and you can commit to it long term. We find that it has a dose-response relationship, so there's a particular type of exercise done at a particular frequency which poses significant benefits for a specific condition.
Exercise works on different conditions in a myriad of ways. It alters the expression of genes, changes hormonal responses, encourages the birth of new brain cells, lowers fat levels, decreases inflammation. The list is endless.
You're not just doing exercise to treat your type 2 diabetes, but it's also helping to improve your blood pressure, it's helping to improve your cholesterol levels and tackle depression and other symptoms, because many patients don't just present with one disorder, and that's the uniqueness about physical activity and exercise.
You okay there? Okay, just 10 more seconds.
While the effects of exercise on some conditions like diabetes, osteoporosis and depression are well known, evidence is still coming in on its wide range of benefits for cancer patients. These men have prostate cancer. The cancer thrives in the presence of testosterone, so treatment involves the suppression of this hormone.
By withdrawing testosterone, there's a number of side effects. For instance, the loss of muscle, the loss of bone, impairments in physical functioning, balance.
Patients on testosterone suppressants normally lose over 4% of their bone density each year. This trial is examining whether targeted exercise can prevent this loss.
We've shown in previous studies that exercise has an important role to reverse the loss of muscle. Now we're taking a step further. We're combining resistance training with high-impact loading activity, which is very likely to be beneficial for bone outcomes.
Jumping is not a normal activity for these men. Each time they land, their skeleton vibrates and takes load. Over time, this leads to beneficial changes in the bones. So this person's been on the trial for 6 months?
So what we can see here, this particular subject's actually preserving bone over time, which is a fantastic outcome.
So that means he hasn't lost any bone at all?
Exactly.
Difficult, isn't it? Try and get your balance back.
Balance exercises lead to less falls and less fractures.
If you have a look at the grey bar there, that's the average for someone your age. And so you're well above that.
Cardiovascular fitness lowers other risk factors. But best of all, exercise may even beat the cancer itself. Large epidemiological studies suggest the right amount of exercise can achieve a drop in mortality of around 50 to 60% for a number of cancers.
Exercise is the only treatment I know of that can achieve this kind of result without any downside. And in a sense, it's a rediscovery of something that's always been beneficial.
The idea that exercise will stop the tumour coming back, it makes me want to exercise more, and anything I can do to stop that tumour coming back is great.
It means the patient are extending their lives in terms of time, so it's a fantastic outcome. It's very exciting for this area.
To encourage more GPs to prescribe exercise, the Lifestyle Clinic has developed a special patient questionnaire. Expect your physical activity levels to be under scrutiny at one of your next checkups. Surprisingly, the results from my questionnaire tell me I have to exercise more. But the upside is, at least I'll be working on prevention rather than cure.